Namaste and welcome to Achievers and Changemakers, produced by Today's Youth Asia. In the TV show Achievers and Changemakers, we bring inspirational figures from around the world who have contributed to humanity. My name is Sunita, and in today's episode, we have the privilege of having with us Mr. Mark Arnoldy. He is the Executive Director of Nyaya Health and was deeply involved in the treatment of acute malnutrition in Nepal as a part of private, public and non-profit sectors. He founded Nepal Nutrition in partnership with Himalayan Healthcare to treat the children, advance local production of RUTF, influence national policy and create new funding streams. You have received the Today's Youth Asia's Young Achievers Award. What are your thoughts on that?
For me, first and foremost, it's an honor, and I'm really grateful to Today's Youth Asia for that award. I think I must admit, though, that it served to motivate me to do even more, because I didn't quite feel deserving, possibly. I think, when you work in rural Nepal, you realize how hard all of these communities, especially mothers, are working, and I think the work I was doing doesn't quite compare. And so I think there's some, millions of Nepalis that perhaps deserve that award more than me. So what it did for me is it motivated me to work even harder. But Santosh always joked with me that I was the first foreigner to receive the award. And so I took that into consideration, and all it did for me is just make me want to do more and do it more quickly. Yeah.
Where do you see yourself 5 to 10 years from now?
I see myself mostly in the same position. 5 to 10 years from now, I'd like to see us doing the work we're doing at a much larger scale, impacting hundreds of thousands of people on a yearly basis. Right now, we're delivering care to about 35,000 people a year, but we're really growing quickly. So I would love to keep doing what I'm doing. I think that that's an important lesson for youth as well, is that once you find your niche, I think it's really important to dig in and to give a good 5 to 10 years minimum. And a lot of the sort of research from around the world suggests that most people who accomplish great things give at least 10 years to that thing. It's very hard to accomplish something great in under 10 years. So I think I want to be in the same position, moving between Nepal and the rest of the world, serving as an advocate for bringing health care to the people of far western Nepal, doing so at a much larger scale, and continuing to work with the community and our partnership with the government.
You must have faced a lot of obstacles in your life. Which has been your biggest obstacle, and how did you overcome it?
Perhaps the most ironic obstacle happened to me on my first trip to Nepal. And I had a life-threatening allergic reaction on my first trip in 2007. And in many ways, that was what compelled me to do the work that I started in Nepal. But I think that's only one instance of a broader set of obstacles that I faced. For me, even growing up in the U.S., I faced an enormous amount of health problems. Most of my first 18 years were spent in and out of hospitals, and had I not been so lucky to be in one of the better healthcare systems in the world, I always say that I most likely would have been dead, and if not dead, very severely disfigured and immobile at best. And so I wouldn't have been able to be the person I've been. So I can't point out one specific obstacle, but for me it's the collection of all of the health problems I've faced, and for me that's allowed me to develop empathy and realize just how fundamentally important health is to us, to allow us to live a dignified and prosperous life.
And who do you consider the biggest inspiration in your life?
I look up to a lot of the great public health figures, global health leaders, and two individuals in particular serve as an inspiration for me. One of those is Jim Grant, who was the former executive director of UNICEF, and he led what was called the Child Survival and Development Revolution, and so he saved millions and millions of lives. And many people say that he saved more than Mao, Stalin, Hitler combined destroyed. So he's really kind of an unknown figure that led one of the great revolutions in public health. And secondly is a current global health leader. Unfortunately, Jim Grant has since passed away, but someone I really look up to and someone who serves as an advisor for our organization is Dr. Paul Farmer, who founded an organization called Partners in Health, which is now delivering healthcare to, I think, over 3.5 million people in 11 different countries around the world. And so they've really changed the way people think about delivering healthcare to the rural poor around the world. So he's one of my modern inspirations.
What got you interested to work in Nepal?
It was just sort of this lucky chance, and that one of my good friends in Colorado became good friend with a Nepali student who was living there, and she invited us to visit Nepal and consider starting an education program because I had actually been working in China prior to Nepal, and so she was interested in the model that we were using and applying that to the Nepali context. So that's why I originally came to Nepal. And then the story from there gets a little interesting and quite ironic, because on my first trip to Nepal I had a very severe allergic reaction, and it happened to be on a day when there was a countrywide bund. So even the ambulances were being stoned on the street that day. I still remember, like, I was walking, and this is my second or third day in the country, so I was totally in shock. And I found myself halfway through lunch having a very severe allergic reaction because I'm allergic to nuts, and it was accidentally misplaced in my food. And so I felt very vulnerable at that moment. And so for me, it's kind of a critical incident in my life because I realized what it felt like to be in Nepal, need life-saving health care, and not necessarily have access to it. And I think as a foreigner, that rarely happens. We usually have, unfortunately, the case is, foreigners usually have special privileges and have special access to higher levels of care than many Nepalis do. And because of the situation that day, I didn't have that. The country was shut down, the ambulances weren't running, and I also didn't even know where a hospital was because I was so naive and so new to the city. And so really that was what served as an inspiration for me, because I was able to develop an empathy of what it felt like to really need care and not have access to it. And interestingly enough, that has since happened a few other times here in Nepal. Despite being very careful about what I eat, I've also had several other very threatening situations up in the high Himalaya, in very rural areas. And so it's sort of an ironic, constant reminder to me. And that's actually why I started the work I did in nutrition.
You discovered the Nutrien fortified peanut butter produced in France, and that led you to developing Nepal Nutrition. Could you tell us about that?
Yeah, so that really started with the story I just told, and that's the great irony, is I'm allergic to nuts, but I found out that this product had been invented in the mid-1990s in France, and it's basically just a fortified peanut butter. And it may sound funny, but it's actually the world's best treatment for severely malnourished children, because the old model of treating malnourished children, you had to bring children to an inpatient treatment facility like a hospital. So in a place like Nepal, where 80% of the population is rural areas, extremely remote, most don't have close access to roads or health facilities, it's very difficult for mothers to leave their home for multiple weeks at a time and bring their child into a center. So the reason this product is so sort of revolutionary in what it does is it allows you to take the treatment to the child rather than the child to the treatment. So now you can treat children in the home. So this opened an opportunity to treat, tens of thousands of children within Nepal that had never had an opportunity to be treated.
For the past 5-6 years, you've been working for the improvement of kids and youths with malnutrition. How was the situation when you first came here, and has there been any improvement?
There were over 90,000 children under the age of 5 in Nepal that didn't have access to treatment, that needed this treatment, would benefit from this product, and they didn't have it. So I'm happy to say that has changed for the better. Since that time, the government and UNICEF have been heavily involved in first starting a pilot project in 3 districts and then expanding that project further to make sure that this product is reaching these children. And so they tried that in 3 of very remote districts in the far western region. And one of those districts is Acham, where we currently work through Nyaya Health. And so I think we're seeing improvement. I think with issues like this, you always want to be voting for improvement to happen at a quicker pace. And so I can say that there's been much improvement, but there's a lot to be done, because there's a lot of children with an unmet need, and the quicker that we can deliver this product that is relatively low-cost solution for a life-threatening condition, the better.
60% of the Nepalese economy is based on agriculture, yet there is so much of food shortage, and that is what leads to malnutrition. How do you think this phenomenon can be tackled?
A lot of the malnutrition in Nepal, specifically this acute malnutrition, is actually, it's very much interlinked with the health status of children as well. So if children are having rounds of diarrhea, or if they have worms, or if they're acutely infected with any other type of condition, they're really at much higher risk for developing malnutrition. So even in areas that are food surplus and food surplus districts, you can still see a very high rate of malnutrition in children. So if you change the food side of the equation, it doesn't necessarily mean you're going to change the status of children. It's a great step forward, but it is much more complex than that. So I think one is looking at increasing modes of production, of course, is going to help with the food deficit status. I think a more difficult but necessary task is also looking at fair trade practices of how food is being exported and then imported back into Nepal. There's a lot of evidence to suggest that districts that should be food surplus are food deficit because the food is being bought up, taken outside of Nepal, and then resold back to those same districts, which is a practice that hopefully some legal infrastructure and some policies can be put into place to help protect those communities, to make sure that they're benefiting from their own food production.
You have a bachelor's degree in pre-medicine and psychology, yet you work for the youths in the sector of malnutrition and food. What inspired you to join this field?
What really sustained my inspiration and my commitment was working with mothers and children in rural communities. And I still recall one interview in particular I had with a woman in Surkhet pretty early on when I started this work. And I was, just continuing to ask questions, trying to understand her life, trying to understand how she thought about getting treatment for her child. And so I said, before this new treatment existed, what did you used to do? When your child was severely malnourished, what were your options? And she responded to me and she said that our prescription was waiting for that child to die. And so, there are shocking moments like that in the history of my work in Nepal that have really served to as continued inspiration. And I think that's going to be what sustains my lifelong commitment as well, is continuing to be actively involved on the ground with rural communities, understanding their problems and listening to them and trying to figure out how they perceive the best solutions. And so I think whether you're a doctor or a business student or an engineer, I think that empathy and truly listening to people, whether they're people of your own country or another, is the key to sustaining inspiration and commitment like this.
Although the Nepal Micronutrient Status Survey states that kids below the age of 5, 47% of them are underweight, 54% are stunned, but still the Nepalese government has not taken an active step in this issue. How do you think the government can and should be involved to resolve this issue?
I think in the recent years you've seen a lot of increased participation from the government, actually, which is great news. And yes, Nepal is home to some of the highest rates of malnutrition in the entire world, both chronic and acute malnutrition. So it's an extremely pressing issue because, what everyone should understand about malnutrition in particular is that each generation that we let pass by with these rates of malnutrition, we're essentially losing an entire segment of society, because what malnutrition does to the body is it stunts you both physically and cognitively. So we're having entire generations of Nepalis grow up that are compromised, both physically and cognitively, and that's not good for a healthy, prosperous society. So malnutrition, more than anything, is a particularly pressing issue. And I think with the amount of resources that have been coming to Nepal within the last 2 to 3 years specifically, you're starting to see rapid improvements and rapid scale-up of efforts to try to address malnutrition from all angles. Not just the acute treatment once a child is very severely ill, but also looking at food-based approaches, getting more at the foundation of, or the root of some of these problems. So I think if you're asking about recommendations on how to go forward, you have to address nutrition comprehensively. And that involves every side of this, from what we call inputs, which are those things you put into a system to make sure that we have increased food production. That's irrigation, sometimes fertilizers. That's debated in different communities. Seeds, access to roads, all of those things matter. On the other end of the spectrum, it also matters that we have basic primary care services and access to comprehensive health care for children. Because like I said, if children are sick and compromised for other reasons, they will never become nutritionally sound. So nutrition is so difficult because we're all so vulnerable to food. And we have to have all of those things come together and merge in a really productive fashion to create a truly healthy society.
Malnutrition in kids can be directly related with the ill health of mothers. And if the mothers are not fed properly, then the kids are not able to feed. And in many rural parts of Nepal, the new mothers, they're not treated well. So how much does this affect the health and nutrition of the child?
It, of course, affects the health and nutrition of the child in very, very large and significant ways. I think, some of the data was showing that, probably 1 in 4 women who are of childbearing age in Nepal are themselves malnourished. And so, yes, you're right. A very negative cycle begins right there. And so I think, but if you want to view this to the positive, I think what a good intervention to address multiple issues at the same time would be, one, there's a lot of investment now in encouraging mothers to deliver in health facilities. And so that involves with some incentives for antenatal or prenatal care. And so mothers are being incentivized and rewarded for making 4 visits to a health facility before they're giving birth. And then if they give birth in a facility, they're also being rewarded. And so I think we need to use this as a window of opportunity to deliver really important nutritional messaging as well. And ensuring messaging isn't enough. We need to also ensure that there's access to proper product and food to take care of their nutritional needs.
Apart from food intake, what are the other things that can cause malnutrition?
A lot of the burden of disease comes from some of the more basic illnesses that children have, and at very high rates still, unfortunately. That's diarrhea, worms, acute infections of other kinds. And so, one, of course, that children are receiving vaccinations, but 2, that we have the proper antibiotics and antiparasitics within a reasonable walking distance of rural communities so that these conditions can get treated immediately. And, intertwined with this is also, of course, the status of sanitation and hygiene practices. But we absolutely must ensure that treatment, that medications are available because they're extremely low cost and effective. And so I would say when you look at things outside of food, this is one of the largest contributors. There are also some cultural practices in particular regions and within particular ethnic groups that contribute to some of the malnutrition seen throughout the country. But by and large, access to a basic set of care services for children is really important.
You have been to several rural areas of Nepal. What, according to you, is the best way to make these people aware about food, a healthy diet, and malnutrition?
My experience actually has been that education is not necessarily the problem. I mean, most mothers are pretty well aware of what they should be feeding their child, how they should be taking care of their child. Where we need to see further investment is just making sure that those mothers have the proper access to those resources to be able to nurture their child. And that's the great tragedy, is that we can't blame this on the fact that there's a lack of education. It's a very basic set of education, and most everyone I've spent time with in rural communities understands what the needs are, but we have to match education and training with the resources. And that's the most difficult side of the equation.
It's pretty obvious that the more problems are lying on rural areas. So how can youths of urban areas help to get people aware about this situation and even help to overcome all these problems faced in the rural areas?
Sure. Well, I think, one, access to information is important. So I think the work that you all are doing here is really vital. And so thank you for that. I think, I'm honored to be here, and I hope that this session can shine some awareness and insight into the condition of children and the situation with nutrition across the country. So I think that's a basic first step, is what I would say to youth within urban areas, which, by the way, I am. I'm also a young person and live mostly an urban life. I would say you have to get out. You have to bear witness and really go out and work with people. You have to go out, get uncomfortable, like live in these communities, understand what the problems really are. And then I would say that after that, do your research and try to understand which organizations are really doing good, solid, honest, transparent work. Because Nepal is saturated with NGOs. And it can be difficult to identify which organizations are doing really great work on the ground. And so you might have to make several visits. You might have to go out, test, try to work in a community, understand the work that an NGO is doing there. If you really believe in it, then I'd say there's plenty of opportunities to continue on in urban centers. You can come, you can work as an intern, you can try to make this your career. It's very possible that you can go into social change work as a career and be very effective. And so, you know, I think a lot of what urban youth do in the U.S. actually can be done here. I think they're kind of parallel worlds in the sense that a lot of urban youth are working with organizations they believe in and respect and know that do good work. Sometimes they're doing that for pay, sometimes they're doing that on top of being students. And a lot of students in the U.S. are linking their studies to very real, tangible change work. So they're writing their honors thesis on the work of organizations they've been doing work with in the field. And so I think that's a good model. I think as young people, it's actually very possible to generate a significant amount of resources, but it's also really possible to give your time and your expertise. And so I would strongly encourage urban youth to do that.
What can be done in situations like these when economic condition is the main cause of malnutrition?
You have to look for shorter-term solutions that act as like a catalyst to bring these communities up to a position where they can be more prosperous economically. So this is the role of government, and this is the role of maybe some public-private partnerships, but I don't think that markets alone are going to solve the problems of the rural poor, because if they were, we would already see businesses flourishing in these environments, and there's very good reasons that businesses aren't flourishing in these environments. So I think you're going to need to see support from the government sector, from the nonprofit sector, and I think it should be done in partnership with established businesses that have profit motive and social impact motive combined, a sort of social enterprise approach. And so I don't have an easy answer because there's not one, and that's, I wish I could. I wish I could give an easy prescription. I wish we all knew what the prescription was, but we don't. What we do know is that you can't have unhealthy communities that will be economically prosperous. So that's why I do the work I do now, is because in Acham district, for example, when we started our work in 2006, we did a sort of robust survey of the community, and we found that almost 40% of the families there were going into debt paying for health care. And so in a district where people make about $141 a year, what can we do to help them get out of economic hardship? Well, we can provide high quality, appropriate health care for free in that community, because that allows them to invest in their child's education and the food they're buying and opportunities for their family. And so I think you have to get these small acts of support from multiple angles in order to get people up to a base where they can flourish economically.
What and where are you currently involved in?
Yeah, so I'm currently the executive director of Nyaya Health. And so what that means for me is I spend about probably 65% of the time outside of Nepal, the rest within Nepal. So we as an organization, we have quite a large Nepali staff. So we deliver healthcare in the far western region. We do that at a hospital, and we also do that through community health programs. So if you add up the number of Nepali staff at our hospital and through our community health program, we have over 125 Nepali staff here in Nepal. We're very unique as an organization because I'm actually the only full-time staff outside of Nepal. And so we invest almost all of our resources directly to Acham. We also don't even have an office in Kathmandu. We essentially have one full-time individual here with a motorbike and a laptop. So we're really trying to approach solving this problem of lack of access to good, high-quality health care for rural populations in a very different way. We're a very lean organization. We're an extremely transparent organization. So we're trying to change the paradigm. We do things like, for example, all of our expenses in Nepal, you can find them public, open, for the whole world to see on an organizational wiki page that we hold. So since the beginning of our work, you can see every single expense that we've made. And so we think we're doing some innovative things like this that are really important for rural healthcare delivery in Nepal. And so that's how I invest my time. In particular, I support our Nepali team in whatever way possible. So I do a lot of work to bring resources for our Nepali team, to develop partnerships, and I work in close coordination with several of our directors on the Nepali team to provide strategy and a vision for the expansion of our programs.
There are a lot of youths who later on aspire to develop their country, the rural development in food or whatever sector that is. Mm-hmm. What is your word of advice to them?
So I would say act now, because there's a lot of opportunities to change your country now, and those don't have to wait. And this is coming from somebody who's also only 25. So I'm not necessarily living the typical lifestyle that people expected of me either. And I decided to go into this type of work early on and carve out a life for myself in it. And it's not always the most safe route, the most secure route. There is some risk in doing that. But I think when you have a level of depth to your commitment, that you'll make it work. And there's never a moment of hesitation for me. And so, I would say act now, and there are a lot of great examples from across the country where this is happening. And so you can't say that it can't be done, because there are many young Nepalis who are doing it. We have two involved with our organization, for example. Agya Podel is our Director of Community Health. She studied in Germany, made the decision to return, and she's now working full-time, living in Acham, directing our community health programs. And she's been the recipient of the Youth Action Fund Award and some other awards that have helped her continue this work. Another great example is Avishek Mala from GAM Power. We also partnered with GAM Power to build solar power capacity at our hospital, which has completely changed our services. So, I would say that just find a way to get involved immediately. Don't wait, because the longer you wait, the larger these problems become. And we need the young energy. We need the energy of youth and the innovation that youth bring, and the different style of thinking. And we need that now. So I would say just find a great organization to be involved in and invest with all of your heart and your time and energy, and you'll find a way to make this a lifestyle for you.
With this, we have come to the end of today's show. We look forward to your feedback. Our email address is youthtya@gmail.com. We hope to see you next week at the same time. Have a nice week. Namaste.